I was stepping down as the executive director of the Austin Project, and we had worked a great deal in the mental health field. And Don Sapone as I said, kind of cornered me at one of our fundraisers and said, would you be interested in serving on the board? Coming meeting with the board and their committee, and I said, yes, I really would, because I knew the quality of work they were doing with children and their families and the community, and thought that I would be able to contribute and also would grow professionally and personally as well. There are not many places that are as committed as the Austin Child Guidance Center to reach out to individual and families. People don't always know about all the service, which is part of the board, but their commitment since 1951 to serving families and children the way they had was just incredible. So I saw a chance to be a part of that. This is an outcome, maybe less significant than some, but we thought there really wasn't any publication that was very short and very clear and very helpful for parents. Working with Ira Isco's wife, Louise Isco, who was not on the board but was willing to interview staff, board members who had a clinical or a background to look at ways, the principles of good parenting. The nice thing is we were distributed, and it's very simple: parenting of good practices, attachment, building a secure relationship at home. But I think it had a really good outcome, and I think this is a publication that can still be made available if we were able to produce it in some way. So, well, one of the things that was happening that was really exciting for the board, and I think for the center, was an effort to expand services and to look at that old waiting list where you can't ever get down to some of the level that you want to reach. So we were looking at some new modalities that also helped with crisis intervention, but also some short-term strategies for children that didn't need the longer intensive counseling that had been somewhat prevalent here before. I think the board really understood how important those services were, but we also needed, as the center needed, to look at other possibilities. We understood all the good work that the center was doing, but we also knew how strapped they were, both in terms of staff and raising funding. And we had a board that was very assertive and very committed to understanding that we needed to help develop the capacity. And we were able to work with the Meadows Foundation, had a board member group that went up there and said, we really want these funds. And so they saw the level of board cooperation and commitment as well as the staff. We received the funding for 2 years, and you can see now with Renee and others what a big difference it made. I mean, we were finally able to have a source to help build the organization, have some non-discretionary funding for creative and other kinds of partnerships with UT, and I think it really made a huge difference in terms of level of services and expansion of the program.